Mainstream medicine is focusing solely on traditional risk factors: obesity, high LDL, bad cholesterol, low HDL, good cholesterol, high blood sugar. And this is one of the areas that I have a problem with because they're missing the boat. They're saying they're focusing on high blood sugar, but their definition of high blood sugar is far different than what we think high blood sugar is. Conventional doctors wait until your fasting glucose crosses the 125 milligrams per deciliter before they label you as diabetic, and they want to recommend treatment. The other one is high blood pressure. So again, we're going to focus on some things tonight: C-reactive protein, talk about glucose, we're going to talk about homocysteine, and these are areas that you really need to know, because I'm still astonished to this day that I find that there are many doctors still not testing for these things in blood work. Mainstream cardiologists fail to appreciate that coronary atherosclerosis is a sign of systemic arterial dysfunction requiring aggressive therapy to correct. Many people, such as yourself, that come out to these type of lectures and talks have decided to kind of take back control of your health. And you're trying to learn about as many of these risk factors as you can. And that's what you have to do. As Ed pointed out earlier, you can't put your health in the hands of someone else. If it's acute, yes. If I'm in an accident, I want the best orthopedic in the world working on me. But for chronic, I want to know, and I want to take care of myself, and I want to know what's going on. Nobody knows my body better than I do. So remember, we're talking about blood sugar, and I said that mainstream medicine is missing the boat here. When will doctors recognize that one of the leading causes of death is sugar? And we get sugar in so many different forms, so many different ways. Your highest risk of heart attack is, on a daily basis, is within 2 hours after you eat. And why? Because your sugar spikes. And that sugar spike causes damage and dysfunction to the endothelial lining of our cardiovascular system. Every time you eat, within 2 hours after you eat, whoop, you get that. And if your sugar is spiking 40, 50, 60 points, and you're already at 125, imagine what's going on in your body. The poor pancreas is just having a fit, trying to get enough insulin into your bloodstream so that your body can deal with the glucose that's in there. You can experience dangerous blood sugar spikes that impair blood flow through the vital arteries, which also leads to heart attack and stroke. Studies show that the risk of cardiovascular death increases in the 2-hour time period after you eat a meal, even when your blood sugar is just 90 milligrams per deciliter, which is far below what mainstream medicine considers dangerous. What is Life Extension's optimal fasting glucose level? Ideally 70 to 85, definitely under 86. My last blood test, mine was 82. I get my work done every 6 months. Conventional doctors wait until your fasting glucose crosses that 125 milligram per deciliter threshold to label you as diabetic. And then that's when they start recommending treatment. You're already in trouble there, folks. Incidence of disease starts to increase when your fasting blood sugar rises above 85 milligrams per deciliter. So you increase the possibility of disease anytime it gets above 85. And they're talking 125. I talked to someone recently and they said, oh yeah, I had my blood work done. I said, what was your resting glucose? They said 100. The doctor said I was fine, it was normal. I said, you're borderline diabetic. So one of the things that we'll talk about is a plan of action of how to fight this blood sugar spike. You can't stop it, folks. There's no magic pill, there's no silver bullet out there that can just stop that spike. But you can lower it, and you can basically defend against a lot of the problems that it's causing if you are aware of it. One of the things you want to do is you want to inhibit the sugar digesting enzymes. One's called alpha glucosidase, and one is called alpha amylase. We need these enzymes to break down sugar so that it can get into our bloodstream. Now, there are herbs that will help inhibit and not let these enzymes break this down all at once. One of them is called mulberry leaf extract. And it would be like me taking a 5-gallon bucket and pouring it into a bathtub, or a cup and pouring it into the bathtub. If you're not inhibiting these enzymes, it's like pouring that 5-gallon bucket in there all at once. You're dumping all this sugar into your bloodstream at once. And like I said, your poor pancreas is going crazy, trying to get enough insulin so that the body can deal with this. This is going to make it so that you're slowly releasing into the bloodstream instead of dumping it all at once. There's another herb called sorghum extract, which also works on these. The next plan of action is you want to reduce glucose overproduction. Our livers, a lot of you are not even aware that your liver actually does a process called gluconeogenesis. Our livers are actually making sugar and dumping it into our bloodstream. So it's not just what we're eating, but our liver is also contributing to this. Mulberry leaf extract stops that process, slows that process down. Sorghum extract also slows that process down. The third plan of action is we would like to increase glucose uptake from the bloodstream. And these herbs that I'm showing you here have done this in clinical studies by as much as 45%. Mulberry leaf extract. And the last one is we want to inhibit transport of glucose into the small intestines, where we can get in the kidneys and get it out of the body before it can do damage. There's an herb called florizin, which is from the bark of an apple tree. And the last is we want to activate an enzyme called PPAR gamma. This regulates glucose metabolism in our body. This is like a little switch or a dial that helps your body deal with that sugar more efficiently or inefficiently if it's turned the right way. And sorghum extract activates that PPAR gamma enzyme. Combining these three ingredients works on key mechanisms to improve your insulin sensitivity, reduce your blood glucose, safely escort glucose out of the bloodstream in the body through the kidneys, and reduce the creation of new glucose caused by the liver. There are clinical studies backing this up. We call this product Tri-Sugar Shield. Sounds like a proper name, Sugar Shield. And it's shielding your body from the damages caused by this spike within 2 hours after you eat. I want to talk about arterial plaques too. We're talking about atherosclerosis, hardening of the arteries basically. Athero means lump, sclerosis means hardening. It's the leading cause of death and disability in the developed world today. We're going to talk about the endothelium lining. Now, you already saw earlier on that one slide where I showed you the endothelium in the inside the artery. But it's the thin barrier that separates that circulating blood through the artery and the smooth muscle interior of the artery. And basically, this is where we generate molecules that influence the structural and the functional integrity of the artery wall. The nitric oxide I was talking about, that's what gives it that flexibility to be able to contract and expand and move blood through freely without raising blood pressure. It can actually open up and expand and let it through. There was a human study as recently as July of 2012 called the Glucose Challenge, and it was published in some of the medical journals, depending on which ones you read. And basically what they found was when they gave these participants 2.5 ounces of pure glucose, not a carb, not a starch, they just said here, 2 ounces of pure glucose. They knew the sugar was going to spike, but they wanted to see what happened when it spiked. 30 to 44% decrease in endothelial function after consuming 2.5 ounces of pure glucose. They took half the group 5 days before the challenge, and they started giving them 500 milligrams of gamma E per day. Gamma tocopherol. Now most of you heard vitamin E and you think of alpha tocopherol. There's actually a beta, a gamma, a delta, alpha, full spectrum. And this is the gamma with all of the other tocopherols in there. And they found that by giving them 500 milligrams of gamma E 5 days before the glucose challenge, they showed no significant loss in the endothelial function. Now, it didn't stop the spike, it can't, but it prevented the damage caused by the spike. The proper intake of gamma tocopherol was shown to limit artery damaging impact of after-meal glucose burst. There was no significant loss of endothelial function. Very simple, very straightforward, natural supplement called gamma tocopherol, gamma E. Here's one of my pet peeves here, is mainstream medicine failing to recognize the importance of C-reactive protein high sensitivity. C-reactive protein is 1,000 times more accurate at depicting heart attack or stroke than cholesterol will ever be. I've seen people with perfect cholesterol drop dead of a heart attack or stroke, and they go, we don't understand. And then they look at their C-reactive protein and it's through the roof. And I've seen people that doctors would say, oh my God, this person needs to be on a statin, their cholesterol is terrible, yet their C-reactive protein and their homocysteine is in where it should be, and there are no problems. I'm going to talk about the role of C-reactive protein inflammation as far as heart disease and stroke. Anybody ever heard of the American Heart Association? Well, if you go to their website, as I did, they, along with the Center for Disease Control, the CDC, put out a joint statement in 2003, 11 years ago, folks, that the use of inflammatory markers in clinical and public health practice, and this statement was developed after systematically reviewing the evidence of association between inflammatory markers, mainly C-reactive protein, and coronary heart disease and stroke. And they basically are saying doctors should be testing for this. There are more of them doing it, but there's still many more when I talk about mainstream medicine. C-reactive protein, if you're not familiar with it, is a blood protein that's produced by the liver whenever there's any kind of inflammatory process going on in the body, whether you're aware of it or not. There are obvious sources of inflammation like pneumonia or knee arthritis. These will raise your C-reactive protein levels. We know this because it's a natural response. But generally, when things like this are going on in the body, we see that CRP levels are higher than 10. The level we're concerned with is between 3 and 10. That's the one that tends to show that there's cardiovascular problems. Levels greater than 3 increase risk for heart attack threefold, even when your LDL, your bad cholesterol, is low. When elevated C-reactive protein occurs in the company of other risks for heart disease, such as increased LDL and small LDL, there's as much as a 6 to 7-fold greater risk of heart attack. But guess what? You're not aware of that if you're not having it tested. What's the role of C-reactive protein in predicting recurrent cardiovascular stroke and events? What if you've already had a stroke or a heart attack? What role does C-reactive protein play in that? According to the American Heart Association, high levels of C-reactive protein consistently predict recurring coronary events in patients with unstable angina and acute myocardial infarction, which is basically heart attack, a fancy name for heart attack. But you got to know what yours is. Now, there are many natural ways to lower C-reactive protein. Vitamin C has been shown to do that, just something as simple as 1,000 milligrams per day. I want you to know that in these studies, a healthy diet worked as well as Crestor, folks, but they don't tell you that in the commercials when they're spouting about how great it is. Cholesterol-lowering foods such as almonds and soy protein and fiber and plant sterols produce the same results of those who followed a low-fat diet plus a statin drug. They don't tell you that either. PQQ, pyrroloquinoline quinone, that's the one I mentioned earlier. It actually lowered C-reactive protein within 96 hours when men took it, but not women. I don't know why. But that's another topic. PQQ is also very good for the heart because this is the first supplement or nutrient to come along in the history of pharmaceutical drugs or nutraceuticals that has ever been shown to help your body make new mitochondria. And if you're not familiar with it, the mitochondria is where we produce 95% of our energy at the cellular level. It lives within the cell and it produces something called ATP, adenosine triphosphate, which is our spark plug for energy. And the last 2 years in studies I've looked at showed that every major disease has been linked to mitochondrial dysfunction. So here's something to come along that will also help your body not only protect the mitochondria, but help it make new mitochondria. And for men, lower C-reactive protein very quickly in 96 hours. So these are things that you can take on a regular basis that will help lower inflammation in your body. Testosterone is very, very, very important for cardiovascular health, especially in men. But again, you need to make sure that you're getting tested properly. Unfortunately, mainstream media gets a hold of stuff like this, and how many commercials do you see on TV about low T? He's got low T, he's doing this, he's taking it, he's rubbing it on here, I'm doing that. You've got to make sure you test for all hormones, because the problem is, I've even talked to doctors about this. I've got a doctor in Cary, and when I explained this to him, he said, no wonder I put this guy on testosterone and his testosterone went down, it didn't go up. I said, what was this, did you test for estradiol? He said, no. Estradiol is the bad form of estrogen. And yes, men, you have estrogen. And if your doctor, when he's testing for your hormones, is not testing for the complete panel to see where everything is, and he just looks at testosterone and says, oh, it's low, and he prescribes testosterone replacement therapy for you, he's missing the boat, because there's a process called aromatization. And this aromatase enzyme takes testosterone out of our body and it converts it to estradiol, the bad estrogen. And when you see men that have very big bellies, almost look like they have breasts, they're what I call converters. Their bodies are going through this process of aromatization. And unless they address the estradiol part of it, it doesn't do any good. In fact, it does more harm to give them testosterone, because this enzyme says, wow, there's a buffet of testosterone there, and it goes to town on it. So when you address it, you need to address it from the full picture. And when I talked about this doctor, he went back and did that, and he found out that the guy's estradiol was 90. It should be below 30. And once you get that under 30, then the testosterone is actually going to do the good things that it should do. Once you inhibit that enzyme so it can't convert it, it will do the good things. So this was just brief. I wanted to make sure men understood that testosterone is a very, very good thing from you, especially from a cardiovascular standpoint. Also, periodontal disease. A lot of people don't associate gum disease with heart attack. It increases your C-reactive protein tremendously, and it increases your risk of heart attack and stroke tremendously. So if you have that problem, again, that's an easy fix. Get it fixed. Lifestyle modifications. People with destructive gum disease almost double their risk of heart attack, and they don't realize it. Studies indicate that C-reactive protein levels decline dramatically when periodontal disease is effectively treated. Next dagger I want to talk about is homocysteine. Homocysteine is a breakdown product of amino acid methionine, and it's found mostly in red meat. And we men like our red meat. Those who consume high meat diets often have higher homocysteine levels. Again, this is an inflammatory marker. Inflammation, atherosclerosis, a chronic inflammatory condition. Excess homocysteine can both initiate atherosclerosis and facilitate its progression. This is a study that I dug up that shows homocysteine and C-reactive protein as far as risk factors for atherosclerosis. There was a study done, and it analyzed blood levels of homocysteine and C-reactive protein levels in heart attack patients. People that already had a heart attack, they said, let's look at their homocysteine and their C-reactive protein. And they compared it to a control group who had no symptoms of heart attack. The groups were matched for serum cholesterol, HDL, triglycerides, age, sex, body mass index, blood pressure. I mean, they couldn't have got more precise about this. This is the results that they found when they compared it to the control patients. 32% more of the heart attack patients had homocysteine levels above 10. 500% more heart attack patients had homocysteine levels above 15. Do you know what your homocysteine level is? If you don't, you need to find out. 572% more heart attack patients had C-reactive protein levels above 3. The study demonstrates the importance of keeping homocysteine below 10. Optimal levels for homocysteine are between 7 and 8, folks. And I know you were dying to ask me, what should it be? C-reactive protein, remember, ideal for women, 1.5, for men, 0.55 or less. One enzyme. How many people have ever heard their doctors say you need to get your HDL up? Okay? There's a reason. If your HDL is elevated at the proper levels and your peroxidase 1 enzyme levels are at the proper levels, you get what's called the reverse cholesterol process. That's where the good cholesterol goes into your bloodstream and grabs the bad cholesterol before it can cause problems and pulls it out of there and gets it out of your body before it can cause damage. How many of you take CoQ10? Everybody should at some point be taking CoQ10. It's good for everyone. You're going to see I've got some information that just came out of a 10-year study. 10 years they've been studying this and testing it. And the results are going to be in our April magazine, but I actually stole some of the information and brought it tonight. But original CoQ10 that we introduced in 1983 was called ubiquinone, O-N-E. People in the study had fewer recurrent heart attacks. 10-year study, not 1 year, not 6 months, 10 years. They followed these people. They saw that it was a potent endothelial defense. What have we been talking about tonight, the endothelial lining? Are you taking the right kind of CoQ10? Most biochemical compounds exist in more than one form. CoQ10 is no exception. A common form of the substance is called ubiquinone, and while it has demonstrated biological activity, it's much less more bioavailable than ubiquinol. Ubiquinol is the so-called reduced form of CoQ10. In chemical terms, that means it carries an extra electron. If I drew a chart for you, you would see one little thing different about these two pictures, and it would be that extra electron. This is important because that electron allows CoQ10 to help neutralize or reduce dangerous reactive oxygen and nitrogen species, which is oxidative stress. Serum levels, the blood serum levels on the ubiquinol person were 60% higher, just taking 100 milligrams once, and they went in and tested the blood. 60% higher. So I don't care if you're getting that buy one, get one free, and you think it's cheap and you're wasting your money. One of the largest causes of death and disability in Americans today, heart failure. Studies show that CoQ10 supplementation at 300 milligrams a day not only restores normal CoQ10 levels, but prevents progression of heart disease